If your gums have been bleeding when you brush your teeth and you have been telling yourself it is no big deal, I need you to stop what you are doing and watch this, because that tiny bit of blood is not about your teeth. Your mouth is sending you a distress signal, and most people over 55 completely miss it. Here is what nobody is telling you. A landmark study followed over 60,000 adults for more than a decade, and what they found was stunning. People who experienced chronic gum bleeding had a dramatically higher rate of 6 serious, life-threatening conditions, and most of them had no other warning signs, not one, just the blood on the toothbrush they wiped off and forgot about. And what I am about to show you changes everything. I am Dr. Helen. In 20 years of practice, I have seen this work when everything else failed. Here is what your dentist probably told you. You need to floss more. Maybe use a different mouthwash. Maybe come in for a cleaning. And look, those things are not wrong, but they are so far from the full picture that they might as well be misleading you. Because what is actually happening when your gums bleed goes far deeper than your mouth. I want you to picture your body like a house. Now imagine the gums are the weather stripping around the front door, that thin, flexible seal that keeps the outside world from getting inside. When that seal breaks down, it does not just let in a draft. It lets in everything. Bacteria, inflammation, signals that something is wrong with the whole structure. Your mouth is the entry point to your entire body. The blood vessels in your gums connect directly to your systemic circulation. That means whatever is going wrong in there, whatever bacteria are thriving in those inflamed pockets, they are not staying local. They are getting into your bloodstream within minutes of every single brush. And here is the part that changed how I think about gum disease forever. Inflammation is not the cause of gum problems. In most cases, after 55, it is the other way around. The inflammation that shows up in your gums is a reflection of inflammation that is already happening somewhere else in your body. Your mouth is the mirror. The disease is somewhere deeper. You have been treating the mirror. You have been polishing the glass when the real problem is what it is reflecting back at you. So, what are those 6 conditions your gums might be hiding? Let me walk you through every single one of them, and then I am going to give you a specific step-by-step plan to start turning this around starting tomorrow morning. Disease 1, Type 2, diabetes. This is the big one. The relationship between bleeding gums and blood sugar dysregulation is so well established, so deeply researched, that many physicians now use gum health as an early screening signal. Here is why. When your blood sugar is elevated, even in that pre-diabetic range before you get a formal diagnosis, it changes the environment inside your mouth. The sugar feeds the bacteria. The bacteria create inflammation. The inflammation makes it harder for your body to regulate blood sugar, and you are now caught in a loop that feeds itself every single day. The Journal of Dental Research published findings in 2019 showing that treating periodontal disease in diabetic patients led to meaningful reductions in HbA1c, that is the 3-month average blood sugar marker your doctor looks at. Not a little. Meaningful reductions from treating the gums. So if your gums are bleeding and your last fasting blood sugar was even slightly elevated, those 2 things are almost certainly connected. Disease 2, heart disease. I know you have probably heard a version of this before, but most people hear it and think it sounds like a stretch. Let me make it concrete for you. The bacteria most commonly found in infected gum tissue, Porphyromonas gingivalis, has been found inside arterial plaque, inside the walls of heart arteries, not in the mouth, inside the heart. Researchers at the European Heart Journal tracked this for years. The bacteria do not stay where you put them. They travel. They attach to arterial walls. They trigger an immune response. That immune response contributes to the same plaque buildup that causes heart attacks. This is not a theory. This is pathology. This is biology happening inside you right now if your gums are chronically inflamed. Disease 3, Alzheimer's and cognitive decline. This one stopped me cold when I first read the research. The same Porphyromonas gingivalis bacteria I just mentioned, the heart disease one, has now been found in the brain tissue of Alzheimer's patients. And not just in a few cases. A study in Science Advances found it in 96% of Alzheimer's brain samples they examined. 96%. The theory, and it is a growing one among neurologists, is that chronic low-grade bacterial infection creates a constant inflammatory burden. Your immune system is always fighting. That fight, over years and decades, slowly damages the blood-brain barrier, and once that barrier is compromised, what happens in your mouth does not stay in your mouth. Memory problems, brain fog, cognitive slowing. These are not just aging. Sometimes they are biology that started at the gum line. Disease 4, rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease. Your immune system attacks your own joints, and the connection to gum disease is one of the most fascinating and underappreciated links in all of medicine. Both conditions are driven by the same type of immune dysregulation. The same inflammatory proteins that destroy joint cartilage are elevated in people with periodontal disease. The two conditions are so closely linked that rheumatologists now routinely ask their patients about their gum health, and periodontists ask about joint pain. If you have stiff, swollen joints in the morning and your gums bleed regularly, those two facts belong in the same conversation with your doctor. They may be two symptoms of one underlying immune problem. Disease 5, kidney disease. The kidneys are your body's filtration system. They are pulling waste from your blood all day long. And when there is chronic bacterial load entering your bloodstream through inflamed gum tissue, your kidneys bear the burden. Research published in the Journal of Clinical Periodontology found that people with severe gum disease had a significantly higher rate of chronic kidney disease. The inflammation, the bacterial toxins, the constant immune activation, all of it has to be filtered. And over years, that extra work takes a toll. What makes this especially dangerous is that early kidney disease is completely silent. You do not feel it. The only way it shows up is in blood work, and in things like gum tissue that have no obvious connection to your kidneys at all. Disease 6, respiratory infections and pneumonia. This one is especially important for anyone over 65. Every time you inhale, you are pulling air past your teeth and gums. If that tissue is colonized with harmful bacteria, you are breathing those bacteria directly into your lungs. Studies have consistently shown that people with poor oral hygiene and gum disease have higher rates of pneumonia, chronic obstructive pulmonary disease flare-ups, and hospital-acquired respiratory infections. For older adults, pneumonia is not a minor illness. It is one of the leading causes of hospitalization and death in people over 65. And one piece of it, not the only piece, but one significant piece, lives in the bacteria in your mouth. Now, what do you actually do about this? I want to give you a real protocol, not vague advice, an actual sequence of steps that addresses this at the root. Step 1, change how you brush. Tonight. Most people brush too hard and too fast. Hard brushing does not clean better. It actually damages the gum tissue and makes bleeding worse. Use a soft bristle brush. Angle it at 45 degrees toward the gum line, not straight on. Use small circular motions, 2 full minutes. Set a timer if you have to, and replace your brush or brush head every 2 months, not every 6, every 2. The bacteria that live on old brush bristles are extraordinary in number. Step 2, oil pulling. 5 minutes every morning before you eat or drink anything. I know this sounds like something your grandmother would have said, and your grandmother was not wrong. Swishing a tablespoon of unrefined coconut oil or sesame oil around your mouth for 5 minutes pulls bacteria out of the gum pockets before they can enter your bloodstream. A study in the Journal of Traditional and Complementary Medicine confirmed significant reductions in oral bacterial load after just 2 weeks of daily oil pulling. Start before breakfast. Spit it out. Never swallow it. The bacteria come with it. Step 3. Address your vitamin C and D levels. Seriously, vitamin C is essential for collagen production. Your gum tissue is collagen. When your vitamin C levels are low, and over half of adults over 55 are below optimal, your gum tissue literally cannot maintain its structural integrity. It bleeds more easily, it heals more slowly, it is more vulnerable to bacteria. Vitamin D regulates your immune response in the mouth, the same way it does everywhere else in your body. Low D means higher inflammation. Aim for 500 milligrams of vitamin C daily from food and supplement combined. Get your vitamin D level checked. You want to be between 50 and 80 nanograms per milliliter, not just above the deficiency line. Step 4. Get a professional cleaning within the next 90 days. Not a regular cleaning, a deep cleaning. If your gums bleed consistently, standard cleanings are not enough. You need what dentists call scaling and root planing, a procedure that gets below the gum line and removes the bacterial colonies living in those inflamed pockets. Most people put this off because it sounds uncomfortable. It is slightly uncomfortable. But it is the single most effective intervention for reversing early periodontal disease, and the research shows it reduces systemic inflammatory markers within weeks. Ask your dentist specifically for this. Do not assume it is part of a regular checkup. It is not. Step 5. Reduce your dietary sugar, and I mean seriously reduce it. I am not telling you to never have something sweet again. I am telling you that if your gums are bleeding and you are consuming more than 25 grams of added sugar per day, you are actively feeding the bacteria that are making everything worse. Sugar does not just spike your blood glucose. It creates an environment in your mouth where harmful bacteria dominate over protective ones. Cut sugary drinks first. Juice, soda, sweetened coffee, those hit your gum tissue every single time you take a sip. Then work on the rest. I want to talk to you directly for just a moment. I have sat across from patients who came to me after years of being told their symptoms were just aging, just wear and tear, just something to manage. And what broke my heart every single time was not the diagnosis. It was the look on their face when they realized how long the signals had been there, how long their body had been trying to tell them something. Your body is not failing you. It has been talking to you. It talks through your gums, through your joints, through your energy, through 100 quiet signals most of us are never taught to read. You are not too late. This is not too far gone. The biology is reversible in ways that would genuinely surprise you if you started today and stayed consistent. Your body has been waiting for this signal. Now you know how to give it. I want to ask you to do 2 things right now. First, drop your city in the comments below. I read them. It helps me understand where you are coming from and what you need most. Second, think of one person in your life who is over 55 and has probably never heard any of this. Send this video to them today, not tomorrow. Today, you might be doing something genuinely important for someone you love. And if this helped you, subscribe. There is more coming. Real information, no fluff. This video is for educational purposes only and does not replace the advice of your personal physician. Always consult your doctor before making changes to your diet or lifestyle.